excited today. I'm very honored to have Mateo Frumholtz and Dr. Robert Gould from the Peace Caucus. So thank you so much for speaking to us today. So you might introduce yourselves and just share a little bit about yourself so your audience knows who you are.
So I worked for 30 years as a pathologist at Kaiser Hospital in San Jose. And in 2012, I went over to became a professor at UCSF in San Francisco, where I work with the program on reproductive health and the environment. During that time, I've had long-term work within Physicians for Social Responsibility. I've been national president, currently president of the San Francisco Bay chapter, and I'm also vice president of the North American region of the International Physicians for the Prevention of Nuclear War. All of that background connects with my work as chairperson of the American Public Health Association Peace Caucus.
Thank you. Mateo?
Yeah, thank you so much for having us here today. So I'm a first-year graduate student doing my PhD at the University of Minnesota Twin Cities. And my research interests focus on the overlap between migration and health, and really coming at it from a public health perspective and trying to focus on prevention of harm done. So the last few years, my work has really focused on how social policy has impacted refugee health and asylum health. So that's kind of where I come to this conversation and my work with the Peace Caucus.
Wonderful, wonderful. So we are APHA 2023. So what is the Peace Caucus hoping to get out of APHA 2023?
Well, we always continue to try to work on our core programs, which over the years have been connecting the issues of needing to oppose militarism, nuclear weapons proliferation, for example, as ways both to decrease conflicts that could literally spell the end of the world, but at the same time rob so much of the budgets that are needed for core public health principles. We're very excited to say, and I'm sure Mateo will also share in the excitement, that we also were working this year to develop a call to health professionals to call for the immediate end to violence in Israel and Gaza. And in that case, to keep the attacks from happening on health professionals and health facilities, to bring in the needed humanitarian aid. So that call has been circulated, and we have had the support of hundreds of health professionals, over 20 organizations, 6 former APHA presidents as well. We're very happy and pleased to support the late breaker resolution that was also trying to call for a ceasefire in Gaza, Israel, and we just got the news that got passed at the Governing Council.
Big achievement, congratulations. Yeah.
Thank you.
So public health in the Peace Caucus. So some people who might not be familiar with public health might be wondering, how's peace connected to public health? Would you mind to talk about that?
Yeah, absolutely. Thank you so much for that question. You know, public health is first and foremost about prevention and about ensuring health. And I think when we think about peace and peace building, public health seems like an obvious sister to that effort. When we think about war-torn areas affected by conflict, one of the first concerns that come to mind are the health of those folks that are there. And oftentimes we take a very reactive approach to conflict when we can actually embed a public health lens on it and focus on prevention. And peace, as Dr. Neil Arya also says, health can be a bridge to peaceful resolutions of conflicts. So that's one of the very clear connections between public health and peace.
Great.
For myself, in a way, it's very personal. I was very lucky when I started medical school in 1973 that my professor of community health was Dr. Victor Seidel, former president of APHA, also a founder of Physicians for Social Responsibility. And in 1962, Dr. Seidel joined with the other founders of PSR in saying, it was impossible for physicians, for the public health system to prepare for a nuclear war. And we had to do everything that we could to prevent it. And they had a series of articles in the New England Journal of Medicine that really illustrated the ethical and moral compass that physicians and public health professionals need to have to prevent such wars from ever taking place. So we've continued that tradition here in the Peace Caucus, as Mateo has said. We're ill-equipped to deal with the problems that are going to arise from a nuclear war, wars like in Gaza, unfolding climate change. We have to put our heads together to do everything that we can to prevent that from happening.
Yeah, there's a lot out there happening, so the caucus is definitely very busy. So now tell me about the books, War and Public Health and Terrorism and Public Health.
The books?
Yes.
Yeah, well, we're indebted to Vic Seidel and Barry Levy, who you'll be speaking to later, for co-editing these incredible books. And I think it really fills a gap in public health that we've seen. For example, about 10 years ago, one of our colleagues, Dr. Shelley White, had an article in the American Journal of Public Health which looked at the paucity of teaching about war and issues that related to public health, whereby she did a survey of about 10,000 courses that were offered in public health schools around the country, and about 6 of them had any mention of what the impacts of war were. So I think those books have in many ways, filled that gap. Both Patrice Sutton and I co-authored articles, chapters on nuclear weapons in both of those books, War in Public Health and Terrorism in Public Health, but they represent really major works in terms of bringing to people either new or old to public health the centrality of these issues in terms of what we have to do to prevent those conflicts and the diverse impacts on public health.
And you bring up the School of Public Health, and you also are a PhD student. So how much of this is, and you mentioned a little bit of that, how much of this is taught in public health?
Yeah, I think that's a wonderful question, because we're right here at APHA talking so much about public health and thinking forward as to what the future of public health and public health training for young scholars could actually look like. You know, I finished my my MPH in 2019, and now I'm studying at the University of Minnesota again. And I can say that I went through my whole MPH without hearing the word peace once. Right, and I think that's really, really important to the foundational teachings that we're really focusing on in these school curriculums. Right, as Bob mentioned, and as those books really allude to, there's really just a major gap of teaching and education when it comes to the really important aspect of war on health, but also how much prevention can actually be done in these things. So this is something that I think all of us can go back to our states and really advocate for the implementation of more peace studies in our MPH curriculums, as well as all of our, you see a growth of undergraduate programs now adopting bachelor's in public health programs. And again, I think what we're really trying to advocate for is a really strong foundational understanding of the inextricable link between peace and public health, so that when we go into the private sector, when we go into the government sector, into the nonprofit sector, we can be really strong advocates for peace as well.
I would only add that, in some ways these things have been, unfortunately, as Mateo is saying, too siloed within public health. So, you're working on nuclear weapons, what does this have to do with anything? But when we look concretely, for example, we have a 30-year program to modernize our nuclear weapons arsenal, which have their horrible effects if these weapons are ever used. But before they're even used, we're now spending, over that course of 30 years, $4 to $6 million every hour to make our weapons more lethal. And if we think of what that money represents for preserving public health, expanding healthcare to all the people who are uninsured, these make these things very concrete to people.
Definitely. Now, there's a new generation of public health professionals coming up. So what is the Peace Caucus thinking about, how do we introduce this new generation of health professionals into the importance of
Yeah, I think that's a great question. It's also very, very timely, right? As Bob mentioned, as we're seeing a lot of the conflicts around the world surface, a lot of geopolitical strife and conflicts. I think it's given a lot of opportunity for young people that are engaged in social media, that are seeing these things unfold through our very eyes, to actually say, there's actually a lot we can do about it. But it also requires us that we're well educated and well informed about these issues, about the historical context of these issues, and about, real solutions that are actionable for us. And and I know that a lot of the time we think that solutions to these problems are so hard to get, right? We think of kind of what happens at the federal level. But I think it's just more than anything a call to action that peace building can happen at the local level. Localism is definitely a huge source of political struggle that's ongoing. And it's also a really, large area for movement. I come from Minnesota, and in Minnesota, some organizations in Minnesota have actually put a price to the amount of money that the state of Minnesota and Minnesota taxpayers actually spend on funding warfare all around the world. That's something that we can advocate for at our state and local level to actually divest from investing in the militarism and the expansion of militarization, nuclear weapons, bullets, things like that. So a lot can be done at the local level. And I think you see a lot of engagement and activism in younger generations and younger folks that are really looking at our elders in this movement for inspiration, and also really energized to move it forward.
Yeah. And you brought AI, you brought social media. So this is kind of the new world of communication and getting the message out there. And even some social movements, political movements, are in the space of social media. So is that something that the caucus is looking into as a tool of sharing the message around?
Yeah, I think absolutely, right? As we look forward, we're definitely trying to grow the Peace Caucus in new and different ways. And I think probably more than anything, we can elevate other voices that are super good advocates already. There's a lot of amazing, for example, TikTokers that talk about nuclear disarmament and what that looks like. There's a lot of amazing social media activists that are already bringing these issues to the forefront. So we don't need to reinvent the wheel here, more so bring them into this broad coalition that we're really forming and elevate their voices as well.
I give a very concrete example that this reminds me of is that the New York City Department of Emergency Management put out a video sort of reassuring people what to do if there's a nuclear war. It was like the duck and cover stuff of the 1950s, stay inside, wait to get reminded. And the New York Committee to Abolish Nuclear Weapons put out this phenomenal video that just repeated this reassuring thing from New York City and overlaid it with graphics and what the realities of a nuclear conflict would be. And there are over 1 million viewers. And I have to say, as an older guy here, that we could not match that type of outreach, except with these new tools allowed us to get out, and particularly to a young audience, to make these things very real.
Great. Thank you for sharing. So, what are the new coming up goals for the Peace Caucus?
Well, unfortunately, these issues don't go away. So much of our programmatic work will be focusing, I'm sure, continuing to focus on the need to abolish nuclear weapons, to utilize the framework and, being at the annual meeting to get these issues out to, folks who are doing great work but need to have the interpenetration of this. So, for example, I do a lot of work on global warming, but our continued militarism and our sort of pumping for oil to get the dollars to buy the arms to fuel these conflicts are issues that we need to be able to get out to our, fellow members within APHA. So we'll continue that type of work. But I also see that particularly with this year and the excitement that younger people who are drawn to this, particularly because of the tragedy in Gaza, sort of has illustrated the need to prevent further conflicts. We're running out of time on our earth. We have to stop these things. So I sense a real energy and excitement that I'm very happy to see new leadership coming in and new ways to communicate, particularly with younger leaders.
Yeah, I think Bob said everything, and the only thing I'll add is, I study migration, mobility, and historically mobility is a mechanism of survival. And for a very long time, we've really exceptionalized that to be, something not natural, and we really have to rethink, that framing. And when we think about mobility and people fleeing violence and persecution, that is central to studies of peace and to peace building. And again, coming at it from a public health perspective, the question is, how can a lot of those things actually be prevented in the first place? And Bob mentioned it, and it's about recognizing the growth of militarism that actually, occupies most of our funding strategies at the federal level, especially here in the United States. Recognizing the enormous impact that a lot of our foreign policy actually has on destabilizing a lot of the world, and how that then has ripple effects on migration and mobility and ultimately peace. So I think, as we look in the next many, many years, it's how can we, organize, how can we build a strong, broad coalition that brings together all the shared struggles. These struggles are all the same, right? Racial equity, colonialism, peace, public health. These are really, really struggles that are tied together. And I think what we really seek to do is peace, liberation. Those are the goals. How can we work together to move towards those goals?
Thank
We're
you.
running out of time. I mean, not for the interview, but in terms of our planet. I mean, in terms of the realities of global survival. I mean, everybody knows that we have to get the sort of global collaboration, which cannot go into warfare, which is one of the biggest polluters in terms of contributing to global warming. We really need to get our act together, stop building nuclear submarines that are going to prepare for warfare in 2080, where we may not have a planet. So I'm very excited about this type of intersectional approach, breaking down the barriers, and really doing what we can within the public health community to build a strong movement to really move on.
So it's all interconnected. We all connected and working together toward the same goal. So thank you so much, Mateo and Robert, for sharing with us today. Really appreciate it.
Thanks for the real opportunity. It's a real pleasure to talk with you.
Thank you so much.